My dear friends, today's topic is very important, and especially in the current era. Perhaps I think that this topic is very, very relevant. The topic is international health. Health and disease, as such, do not know the boundaries which are geographically or politically marked. It doesn't know that this is X country or Y country. The disease, for an example, corona, this COVID 19, has spread all over the globe. That means if somebody is negligent about prevention and control of this disease, the disease can spread to many other countries. That's why when we talk about international health, we need to talk about the possibilities of the disease being transmitted from one country to another country. Actually, since centuries, people have been trying to prevent, to control disease by identifying some means so that the disease doesn't spread so frequently and quickly. So, detection and isolation had been tried since centuries. Once a particular disease has been broken down in an epidemic, the people tried to isolate people. And the word quarantine actually initiated the beginning of the international health scenario. Quarantine was something which was used for the people who were traveling with the sheep, the crew of the sheep, and when they reached to a particular harbor and if they were found to have some disease or possibility of a disease, they were isolated. The beginning of this quarantine was, let us see whether the persons who have arrived at the harbor, they within a given period of time develop a disease or die. At that time there was no concept of incubation period, but even roughly they knew that the people who are infected are likely to die within this period if they do not get treated themselves. And that's why, roughly for 40 days, people with the possibility of plague were quarantined. This was long back in the 16th century and 17th century. But as there was no scientific background, there was an opposition with different countries because each country wanted that their citizens, their travelers should not suffer. So quarantine lacked scientific knowledge. There was quarantine, but it lacked scientific knowledge. And it needed some international agreements. Even in this current situation, we have several problems related to China, America, and other countries where they are quarreling with each other, telling that they were not informed adequately or in time. So there has to be some international agreement to protect the health of each other, not myself, but each other country. And in that background, several discussions took place, several seminars were organized, and international conferences were also organized since very early days of 1851. The first international sanitary conference in 1851 had this particular objective in mind. It was launched in Paris, and surprisingly, the conference lasted for 6 months. They discussed a lot about everything. The countries were very developed, very advanced countries of those days, like Britain, France, Austria, Greece, Portugal, Russia, Spain, Italy, Turkey. All these countries happen to be European countries. And they had one single objective in mind: uniformity in the rules and regulations of the quarantine. What was the result? No result. Ultimately, it was a failure. But however, the seed was already available to the globe. That this is how we can go ahead. So, international sanitary code was identified. There were some 137 articles into that. This preparation was done, but nobody tried to implement it. It was ratified only by three countries. And out of only those three countries, only one continued to use it till 1865. So remember, 1851 there was some beginning for international collaboration in the field of health. But up to 1865, apart from some discussions, nothing happened except in the France. So in somewhere, such conferences continued to be called. Say about 10 times such conferences were organized up to the end of the say 1900 or so, 1990 or 1900. And in those days, these conferences also did not have any result. Do you remember it? 1851 was the beginning. 1902, there was some breakthrough. For 50 years, they went on discussing, identified some code of conduct for the sanitation, but could not do much. And this is how you can understand that internationally also there are so many disputes, so many differences of opinions. Each one tries to protect oneself, but that harmony was not established. But the first thing which evolved out of this is in 1902, United States took a lead. United States of America, a Pan-American Sanitary Bureau, in abbreviation PASB, was initiated. And then in 1924, they also established Pan-American Sanitary Code. That means they devised some regulations for sanitation, for quarantine, etc. And that Pan American Sanitary Force is even today by and large in force. So they must have been visionaries that it can continue for century. 1947, out of this Pan American Sanitary Organization was established, PASO. So this was the beginning. We knew that since centuries the quarantine was used, but only in the last century, in 1949, PASO became the American Regional Office for WHO. Will you get it? So it was the beginning in America in terms of the sanitary organization. They established the sanitary code also. And once that was established, they started with the PAHO. PAHO is a Pan-American Sanitary Organization converted to Pan-American Health Organization, which has a head office in Washington, D.C. So ultimately, by 1958, you can roughly say that with a span of about 100 years of journey, of discussions, deliberations, conferences, and then they came out with a Pan-American Health Organization, which is a very leading organization of the health in the international scenario. Followed by this, somewhere in 1907, there was a simultaneous development in France. Office International de Hygiène Publique. It had its office in the Paris. And then in 1903, International Sanitary Conference established International Health Bureau. Would you get it? In 1903, there was International Health Bureau, IHB. Can you compare with the American Sanitary Bureau? It was somewhere in 1902. So parallel developments. 1902 America, 1902 International Health Organization, Health Bureau. Both were by and large supported by the advanced countries of that time, that is Europe and America. 1907, this OIHP or Office International de Hygiène Publique, that was in 1907, had two objectives. One, to supervise international quarantine measures, which was an objective since centuries. Quarantine has to be standardized, how to do it, how long it should be done, etc. And the second was dissemination of the information about communicable diseases. Please remember that in those days the only issue was related to communicable diseases. That's why one, quarantine regulations. Two, the issues related to the spread of the communicable diseases and information to be disseminated for that. That much progress could be done up to 1907. Initially, it was, as we have said, that OIHP was doing that for Europe, but later OIHP of the Europe and PAHO or PASB of America, they had a coordination. They started working together. And believe us that by 1907 to 1950, about say 70 years before, there were considerable inputs by this combination in the health issues. They could disseminate the information, they could devise the rules and regulations for the quarantine, and this was very useful. Followed by that, the Health Organization of the League of Nations. Some of you may be knowing that in the beginning of the last century, there was First World War. It was in the 1914 to 19. At the end of the World War, the entire world realized that there are issues, not only political issues, but there are issues related to the health. For sorting out the political issues, solving them, they established League of Nations. League of Nations was a group of the nations which were working together for welfare of the world, for the better world. And this was for the prevention and control. They had a health component also, which was known as the health component of the League of the Nations. What did they do? Health Organization of the League of the Nations? Actually, they could not do much creditable work. But something like, say, quarantine regulations, yes, they did it. Plus, epidemiological information was established. It is worth remembering that the same epidemiological information bulletin is now continued by the WHO, World Health Organization, that we will be talking about. Additionally, several new things also came up. It's very unfortunate that the League of Nations failed politically, even socially. But from the health point of view, its division of health had some success stories also. One, that they continued with the quarantine regulations and also dissemination of the health information, epidemiological information. Newer things were, number one, there was something that issues taken up in nutrition, housing, and rural health. These are the new issues. They took it up. Added to that, they thought about training of the public health personnel. You see, the span, the scope of the organization increased. Standardization of the biological products, those preparations like say drugs or equipment, they are being standardized now. They started also periodical epidemiological report. Periodical epidemiological report which continues with the WHO also later by. They established Far Eastern Bureau of Singapore. So from Europe and America, now they shifted one unit to Singapore. They also established guidelines for the technical studies. Nobody till that time thought about the research, technical studies. And these technical studies later on continued by the WHO. I would repeat several things, that health section or health organization of League of Nations established in 1923, though the League of Nations failed politically, the health organization succeeded in several things. Number one, they continued with the quarantine regulations. Number two, they continued to disseminate the information about health, and they added new parameters. One was naturally training of the health persons, which was a new public health persons. They standardized the biological drug products. Three, they thought about the research, and they extended their scope to the Far East in Singapore. Now, amalgamation of this OIHP, the earlier Organization of Europe, PASB, the Organization of the America, and HOLN, the Health Organization of the League of Nations, all got together, but they failed because they were working separately. There was no actual unity. They were working for their own objectives, but still they could do some beginning in the field of the international health. In 1939, League of Nations were dissolved. But you see, surprises. Now people must have realized that health is an important issue. So Health Organization of the League of the Nations, that continued. Isn't it? The League of Nations as a political entity was dissolved, but its health counterpart continued. And what happened thereafter? In 1943, at the end of the Second World War, the United Nations Relief and Rehabilitation Administration, because United Nations came into being, and they had to care for all those victims of the war, children, mothers, and all of them. So UNRRA, United Nations Relief and Rehabilitation Administration in 1943, they were supposed to organize recovery from the bad effects of the Second World War. And they also had a health division. which was to take care of the millions of people which were displaced. And they have to revive the information exchange. Information was necessary for the health also. Plus, they had done outstanding work in two areas. They worked for the control of typhus, which was a very dominant disease in those days. And second, they worked for the control of the malaria. And believe me, the concept of eradication of malaria actually started in those years of 1943-44. In 1946, this United Nations Relief Administration was terminated because it was now not required. But all the assets were handed over to WHO. So now, my dear friends, with this long history of 1851 to 1945, there is one milestone named WHO. How it came? That April 1945, WHO took its birth at San Francisco, US. Somebody asked me, when was the WHO started? It was 1945. And during that United Nations establishments, this work took place. But in New York in 1946, just 2 years before 1 year before our independence, the Constitution was drafted. And surprisingly, the initiative of that Constitution and the draft was taken by China and Brazil. These countries are named for that. But ultimately, many countries got together and established an interim commission to plan for the new WHO. This WHO recommendation or the proposal was ratified on 7th April 1948. What is that? Every year we celebrate it as a World Health Day, WHO Day. And it is a single worldwide intergovernment health agency. Single worldwide intergovernment health agency, which is that WHO, World Health Organization. The beginning ratification and the final beginning of the work is 7th April 1948. Now, by and large, when we talk about international health, in current scenario, we are talking about WHO. Let us have a look at a primary look, the superficial look at the works of the WHO. WHO works for several issues, and all these issues are very, very important. One, it works for the direction and coordination of all these countries for the international health work. It's a single agency which is doing this task. Second, it allows the countries to identify the problems. It helps them. It gives guidance. But ultimately the countries decide their problem because each country will have separate problem, distinct problem. Define the health policies for solving out that problem and decide the targets, when to do it. Also draft the programs for that. Also develop strategies how to do that, how and to decide principles and different programs to do that. The entire sequence. Think about your problem, think about the strategies, think about the planning, decide the target. So WHO guides, and not only guides, it helps in monitoring also. It supervises also if you wish. So countries are free to decide on a specific draft. Once they do it, WHO guides them, and then the countries go for the international health network. The third task which it comes is, it promotes international standards in health. Whether it is standards related to laboratories, standards related to health manpower, standards related to quality of education, WHO tries to promote them. How does it do it? There are several areas. I just name it and then we wait for the next episode, next video. The most important ideas are the prevention and control of disease, one work which WHO is doing. Second is development of the comprehensive is all about comprehensive health services. 3, family health, mainly focusing on the maternal and child health. 4th, environmental health. 5th, health statistics. I will be talking about the importance of each one later on. Then biomedical research, that's also very important. And then health literature and information. Whatever we plan, whatever we have information, that should be distributed to everybody. And cooperation with other agencies. There are a large number of people, large number of organizations working all over the world, including the governments. WHO tries to coordinate with them. So, my dear friend, we have talked about the history of international health, starting from centuries again, starting from the word quarantine. It went through the League of Nations and many other organizations in Europe, America, PAHO, Pan American Health Organization. Ultimately, all of them worked with the same idea of regulation of the quarantine period, how to prevent and control the disease. But then the scope and span expanded with the experience. The world had experienced two world wars. There were a lot many calamities, deaths and diseases. There were epidemics, and because of that, the people had been perhaps wiser. And in 1948, we had WHO. We talked about the main functions of the WHO. Out of them, outstanding is prevention and control of the disease. Earlier, it was communicable disease. Now, it is communicable and non-communicable disease. Nobody can say that it works without the focusing on the mother and child. We need to focus on the nutrition and other issues, environmental issues. All these issues are taken together, and that's why WHO is a very good span, a big network all over the globe. How it works, where it works, we shall be talking in the next video. Thank you all.